Now let's cover the primary code sets. These are the code sets that will cross your path most often in everyday life as well. Every time you go to the doctor, these are the code sets that they'll be using to treat you. Now, if you go to the dentist, it'll be a different code set. I already showed you those. Or if you go to the pharmacy, they use their code set, the NDCs, to track the medications. But an inpatient, again, even if you go to the hospital because you fell down and broke a bone, those again are ICD-10-CM, and ICD-10-PCS is the procedures for inpatient, CPT is procedures outpatient, and HCPCS, which is services and supplies. These are all set in manuals, and these manuals are like the dictionary. Think of the Webster dictionary that we used to sit on at the dinner table if you were a child. They're great big giant manuals that allow us to translate. They have the code and the translation definition in them, and most of them are alphanumeric. You do not have to have these memorized because you can't. But if you've been in the industry for a significant amount of time, you just do have these memorized because they cross your path so often. And it's advantageous for you to be aware of them, just because if you go to the doctor and they get something wrong, when you read your documentation, it can affect you down the road. In the past, we used to say it was really hard for someone that got accidentally diagnosed with diabetes to have diabetes taken off your record. And you can imagine before they said that you couldn't have pre-existing conditions, because that's the way it used to be. Now nobody really thinks about that very much because we haven't had to worry about it. But in the past, if you had diabetes, you might not be able to get insurance because you had a pre-existing condition. If it was accidentally put on your record by mistake, you had a booger of a time trying to get that off. With the ICD-10, we're going to start with it and delve into a little more depth as to what it is, how it's maintained, and what it's used for. The primary function is for the diagnosis coding. Now, ICD stands for International Classification of Diseases. We're in the 10th edition, and clinical modification. Other people in the world also use ICD-10, but they don't have ICD-10-CM. That's exclusive to the United States. Canada is ICD-10-CA. Australia is AS, I think. And like Finland was FN. Wherever you go, they have their own version. And the reason they do that is because there are things that they maybe treat or the way they want to convey data that'll be a little bit different than the way we do it in the United States. For the most part, the code set's the same. So several years ago, I had a person I knew in Finland, and we were conversing on the internet about our different codes that we use for different diagnoses, and several of them were the same. However, they had expanded some codes to where we didn't have that expansion because it was more prevalent in her area than it was in mine. And overall, we can still communicate with the same ICD-10, but it is tweaked and personalized for geographical reasons and other purposes. But the primary focus for ICD-10 is your diagnosis. So we track diseases, we track medical conditions and causes of injury. Now, when we say diseases, that's all of your diagnosis, like I mentioned before: diabetes, hypertension, whether you, everything. My brain is just a whirl of the different things that you could have: a heart murmur, you could have an ingrown toenail. There's so many things that you can track with the disease. A medical condition might be the new SDOHs, so social determinations of health. If you're not able to get your medication due to the recent loss of your job, there's a way for them to track that. That is something that affects the medical condition that you have, and we want to be able to track it. It's not a diagnosis. However, it's in the diagnosis code set because it tracks that condition. And the cause of injury. We can document that someone can have, let's say you were at a parade in your local hometown and you were walking and watching the band at the same time and you bumped into a light pole and got a contusion and needed a laceration, needed some stitches. They can track that. They can even say that you're at an event that was a parade and that you hit your head on a light pole. They can say that you sat on a knitting needle. They can say you fell off of a horse in a sporting event versus riding for pleasure. They can say that you got bit by a dog, whether the dog was your dog or a stranger's dog, whether it was in your house, in your backyard, or at the park. There's just all these statistics that we can capture for the cause of injury. Now, with the United States version, it is still owned and published by the World Health Organization. It's mandatory under HIPAA for diagnosis reporting, and it's maintained by the CDC, which is the National Center of Health Statistics. Remember, we use these code sets for statistical purposes. Used in all healthcare settings for billing and reimbursement, disease tracking and quality reporting, and public health research. But billing and reimbursement is what most people talk about. But we have to remember it's bigger than that. People just talk about the money because that's what gets the most attention. The code set structure itself is 3 to 7 characters and they're alphanumeric. So they all start with a letter, and they include laterality, episodes of care, and detailed specificity. So we can say that you broke your left femur, and this is a subsequent visit, and the femur fracture was on the distal end. So there's so many things that we can say. That's just one example, but there's a lot of content that can be described in that. And another example would be a person that had type 2 diabetes, but they don't have any complications. That's E11.9. If they have complications, it's E11 if they're type 2, E10 if they're type 1. And now we got a brand new code for type 2 diabetes in remission. We've never had that before. But why? Because statistics are showing that with these new medications for diabetes and people losing weight, they can have type 2 diabetes. It doesn't go away. It goes in remission because they lost weight, they changed their health and lifestyle habits, and their A1C has improved. So now we can track that and probably get more medications paid for by insurance or other tools. Another one would be M84.362A. That's a stress fracture, left tibia initial encounter for fracture. V00.821D, fall from baby stroller subsequent encounter. So again, it's really interesting how the code set can be very specific for us to be able to track. Here's an example of how the codes are set up. We'll have 3 characters and then a decimal. The second character is numeric, and the 3rd and 7th characters are alphanumeric, and there's always a decimal placed after the first 3 characters. That's how you look at it, and it's an ICD code. The strengths about ICD is that it is highly specific and standardized globally, essential for epidemiology studies. And so if a person has type 2 diabetes and they don't have complications, and you go to the UK, you're probably still at E11.9 because that's such a standard beginning point for diabetes. Now, limitations. It is complex, and there are thousands and thousands of codes, and it's focused on what's wrong, not really the clinical reasoning behind what's wrong. The ICD-10-PCS, even though it's more of it's for inpatient, it has that clinical reasoning for the procedures behind it. And so it's a really fascinating code set. even though it's procedures, not diagnoses. But that's the goal, is to be able to follow the clinical reasoning. And we have that more with 11 when that eventually happens. No timetable on that. With ICD-10-PCS, same thing, International Classifications of Diseases, 10th revision, procedural coding system. The primary function, again, is inpatient hospital, and it's the medical procedures that they do to you, anywhere from putting in an IV to doing a heart transplant. It's mandatory, again, under HIPAA. It's maintained by the CMS. And if you didn't know, that's Center for Medicare and Medicaid Services. It's used for the inpatient setting. It's for billing and reimbursement, classifying of grouping inpatient procedures, and also data collection and analysis. I'm looking over here. So Laureen had said ICD-10-AU is Australia. Thank you for looking that up, Laureen. I knew it'd be really fun that if somebody wanted to go and do a study and find out what all of the other major countries in the world's ICD-10 was. Wouldn't that be fun to do? You might want to get together at work and have a fun game or something. So again, ICD-10-PCS isn't as old as some of the other code sets. It's newer. However, because we used to have ICD-9 Volume 3, but when ICD-10-PCS came out, it was a real game changer. It was a little intimidating, and it is intimidating at first. It's complex, but once you get in the rhythm for using it, it makes complete sense, and it's easy to follow. We have a course in that if you want to know more about ICD-10-PCS. The code structure itself, the reason it's a little confusing is that it's 7 alphanumeric characters. They are divided up into sections. So the first section, the first character, identifies the general type of procedure. So what's being done? Is it medical? Is it surgical? Is it obstetrics? Are they doing imaging, nuclear medicine, administration, chiropractic, or mental health? And that's just some of the things they can do. And then the 2nd through 7th characters, they are like little boxes that can be turned to meet the needs. So once you know the main section that you're working in, then you can represent the body system, the root operation of what's being done, what body part the procedure is being done on, what approach are you doing it? Is it going to be open or closed approach? What device, what qualifying information that would be used to do that? So if a person was going to have an endoscopic upper GI, then you know they're going in through an orifice that's already an opening. They're not having to make an opening. And so that's got its own section. What body part are you working in? The esophagus, stomach, and how far down you go to track. All of that, and what device is used, the endoscopic tool that's used, is tracked as well. Now, the code set itself is 7 alphanumeric, as I said. However, look at these, the way it looks. There's the section is the first code or character. The 2nd character is the body system that you're working in. The 3rd is the root operation. What's being done? Are we going to visualize something? Are we going to take out something? Are we going to destroy something? Then the body part that's being worked on, what, not only body part, body system. Is it the gastric, the integumentary? Is it the brain? And then what approach? Open, closed? Are we going through an orifice that's already part of our body? The device that's used, and sometimes we have to use like fluoroscopic imaging. That would be part of that. And any qualifier that, and again, if you're interested in learning more about this, we have some great free videos on our YouTube channel, but we also have extensive information in the club and our CCO Academy. But we do have some great courses on PCS. Now, examples of what they look like. So this is 0DT-J0ZZ, and it's resection of appendix, open approach. So resection means we're removing it, the appendix, and how are we doing it? We're not doing it laparoscopically, we're doing it open approach. And then 3C1ZX8Z, irrigation of indwelling device using irrigation substance, external approach. And again, that looks really intimidating, but the fact is these characters are somewhat maintained throughout the whole system. So certain body systems are always the same, no matter what you're going to be working in, root approach or now the strengths. The great thing about it is it's logical, it's consistent, there's structure to it. And once you get to using it, you're never called to memorize, but especially if you're working in a specific area where you're doing cardiothoracic, these are all going to be about the same, right? So you'll get these codes pretty well in mind. And then, but maybe you work for a surgical where you're doing all types of body systems. Again, since it's like turning little blocks to move in the right order to meet all the needs to describe the procedure, it's straightforward. It expands for new technology easily. That's another reason why we had to get rid of volume 3, and PCS is so much better. It's very expandable. It enables analysis of surgical trends and outcomes much more than we've ever had before. And because of that, when new codes or new procedures come out, then we're able to code for them much quicker than you can with CPT, because CPT is not very expandable. It's very old-fashioned. And then the limitation, though, is require specialized training due to the complexity, and it is exclusive to the inpatient hospital setting. It is intimidating when you first start using it, but it's like everything else. Once you get to get in the flow, it's a lot of fun to use. CPT, speaking of them, that's for current procedural terminology. You'll know if you've been following us for any length of a time. Again, not my favorite code set. I use it every day. It's necessary, but it's not really as good as PCS, although PCS doesn't have all of the areas the CPT covers, because CPT covers both outpatient and inpatient services, as well as services like consults and E&M values, which could be added to another code set. But we aren't able to do that with anything but CPT. It's mandatory under HIPAA. Again, the government requires that we use these code sets. It's maintained and exclusively owned by the AMA, which is the American Medical Association. It's used for billing outpatient procedures and physician services and inpatient physician services. So if you're not sure of the difference, when the hospital bills for something and charges, that's PCS. When the physician does their part, that's CPT. The organization is done by sections. So you have evaluation and management, that's the first part. Then you have anesthesia, surgery, radiology, pathology, laboratory, and medicine. And just the whole code set is divided up like that. So the very first is NM, or evaluation and management. It's all about what's being done to the patient. We have to be able to evaluate and manage them, evaluate to give them a diagnosis and to manage that diagnosis that they've got, from something that's chronic to something that's acute. And the code set after the E&M is pretty much numeric and consistent. But you'll notice that the E&M, even though it's at the first of the manual and the first of the list, it starts with 9-9. But the rest of the code set starts with anesthesia 0-0, goes all the way down to the very end of medicine, which ends with 9-9-6-0-7. So for the most part, it's numeric. It is not alphanumeric. There are some codes that have letters in front of them, but they're specialty codes or temporary codes that have T's at the end. And you can learn those more if you decide to get more involved with it and look at the code set. The way they've organized the categories, category 1 is established medical procedures and services, and then that has to be supported by clinical evidence. So you can't have a CPT, you can't bill or have a CPT code without an ICD code, because you have to validate why you're doing something to the patient. So if there is an annual wellness visit, the patient isn't being seen for a sick visit, and there is a Z code that substantiates that the person's there for an annual wellness visit, which has its own code, and then that Z code if there's nothing wrong, Z00.00. And then if there is something wrong with them, Z00.01. Now, you think of other E&M codes or any other CPT code, you can't justify going in and doing a surgical procedure, say, without validating why. So if a person is having their gallbladder taken out, they can't without having a reason. They have cholecystitis, or they have consistent nausea and vomiting and low choledyskinesia or something like that. Again, CPTs have to have an ICD to validate it. And if they don't match, then there's a problem. You wouldn't be doing a heart transplant on a person that had cholecystitis, in other words. With these, there's also category 2, which is performance measurements and quality of care tracking. And then category 3 is emerging technologies. So these are what we tend to call baby codes or temporary codes. It's new things that have been developed that haven't really gotten traction yet. They're so new that they have a little temporary code. And then usually when you have new codes come out, after it's gone through that grace period, then it'll get a real CPT code, is the way we joke about it. Also referred to as HCPCS level 1. So CPT codes are actually HCPCS codes, but we don't talk about that or say that, but it is. The code structure is a 5-digit numeric code, and you were able to see that. Some examples would be 99242 is office or other outpatient consultation, new or established patient, straightforward medical decision making. And then there's also 36555, insertion of non-tunneled centrally inserted central venous catheter, or 80047, basic metabolic panel. And again, not only do you need to know the code itself, but the definition. You have to be able to translate. The strengths, that provides a uniform language for reporting the medical services, and it's updated every year with new medical advances. So the new codes have been given to us already, and they'll start on January 1st of the new year. The weakness is that it isn't that expandable, and there is technology and rapid growth and innovation constantly, so it struggles to keep up. It isn't flexible, but like PCS, so codes get out of sequence as they delete and add new codes. Now with HCPCS, that stands for Healthcare Common Procedural Coding System. The primary purpose is coding for variety of services, supplies, equipments that aren't identified by CPT codes. Now, there are some CPT codes that they don't do equipment and supplies, but they do some services, but these are ones that aren't in the CPT code set. It's also government mandated by HIPAA. It's maintained by CPS, and it's used to obtain reimbursement for Medicare and Medicaid for products, supplies, medication. They also have some non-physician services, such as ambulance services can use those codes. Durable medical equipment, so if you have to order a wheelchair for somebody, or a walker or a cane. Prosthetics, whether it be an eye or an artificial limb. Orthotics and supplies when used outside the physician's office. And it's also referred to as HCPCS level 2. The code structure, 5 characters, alphanumeric. First character is a letter, second to fifth characters all numbers. So an example, if we have somebody that has an ambulance ride, it would be A0021, ambulance service outside state per mile, transport Medicaid only. And then E0110, crutch, forearm pair. So that is the imaging that you see there. Strengths, allows for more accurate billing because we can track everything that's being done for the patient. And then the weaknesses is with the other code sets, HCPCS has to be updated every year. And as new things come out, new devices and stuff that can be used, it isn't always up to date.
Looking for medical coding, medical billing, and risk adjustment education? Learn more at cco.us.